I don't think that healthcare needs to be the Wild West. It shouldn't be like a scratch and win, like hope my parents have money, like, oh no, I was born without money, and so I have to die of something really, really silly.
Win, thanks so much for doing this. We really appreciate it.
Yeah, of course.
So at the 2016 NBA All-Star Celebrity Game, you won the Player of the Game award, and you decided to use your acceptance speech to make a political moment.
Congratulations.
Thank you. I just want to say, as an election year in the U.S. has a lot they can learn from Canada. Healthcare, taking care of people. And I think
So we're talking about celebrity stuff, not politics. Congratulations on your MVP.
So we just wanted to give you a chance to, I guess, finish your thoughts on what Americans can learn from Canadians on healthcare.
Well, first of all, I mean, the context was it was a basketball game between a Canadian team and an American team. And so if you're on the Canadian team and you beat an American team, pretty much the only thing you have to talk trash about is healthcare because it's so much better. I mean, there's a lot of things that the United States has going for it, but healthcare is not one of them.
And so you have a unique perspective because you were born in California, but you were raised in Texas.
Yeah.
And then you moved to Canada a little later on when you were about 20 years old, I believe, right?
Yeah, I'm in
so,
Canada for about 15 years. I consider myself an American Montrealer.
I see. So you've seen both systems, right? And so what would you say are some of the biggest differences between the two systems?
Well, I mean, I remember when I was, there was 1 year that my dad was unemployed when I was in junior high. And my family wasn't wealthy. We were kind of lower middle class, but my parents spent money on education. And I got appendicitis, and I remember going to the hospital. We had no health insurance, and kind of waking up from the anesthesia, and my parents being like, "Time to go home." And I was like, "I don't want to go home. I want to stay in the hospital." But like, we had to leave the hospital the second the surgery was over, and it basically, my parents had to pay out of pocket, and it's essentially a semester of university. It basically costs what it costs to go to the University of Texas for a year to have my appendix out, which is kind of crazy.
Right.
Yeah.
So we're having this debate here now in this country. As you know, Senator Sanders just recently introduced a Medicare for all single-payer legislation. One thing that we're doing is talking to our neighbors in Canada about their health care to explain how single-payer works and what it's like living in a country with universal health care.
One of the examples of a single-payer system that is working well, that is popular, is the Canadian system.
The crazy thing is, like, if someone breaks their arm, it shouldn't be a question of what do I do.
Right.
It's 2017. If you break your arm, you should go to the hospital. And there's way too many Americans that are in the situation where something happens to their child, and you're having to kind of balance your income versus how much you think it's going to cost, and instead of just receiving really obvious and available care that's been available for extremely long time. I have a 4-year-old. Where the system in Canada really shines is with children, and they put a lot of resource into early childhood, and you just end up saving so much cost on the back end by investing in kids and making sure that kids have the best access to healthcare and are kind of overserved. The main difference that I see is that if you're working class, or if you're not of means, if you're wealthy, like I have money, I live in Canada, I can go to a private clinic. It doesn't really tremendously affect my health outcomes. I can go to a doctor in the US, I can go to a doctor in Europe. It's not really for me. But 90% of my friends, are able to have access to healthcare that they would have to take into this cost-benefit analysis rather than just kind of taking care of their illnesses and kind of preventative care.
What's interesting in Canada is that across the political spectrum, pretty much all politicians agree on keeping the Medicare system in Canada. Yeah. Politically, it's like a non-starter if you try to attack Medicare.
Yeah.
Why do you think it's different in the US?
I just think there's been a lot of scare tactics, and people, I really think the Canadian system came out of the British system, and I just think it's really different that during World War II, when England was getting bombed, I mean, rich and poor were all in the same bomb shelters, and I think there was like just a sense of communality and realizing that we're kind of all in the same boat when it comes to healthcare, that it's not really a class issue. And I just think that situation has never presented itself in the US, where people have just been forced to be in the same plane, where you have this, where the very wealthy are willing to make sacrifices for the bottom 80% of the country. And that's really what it comes down to.
And one of the scare tactics is to say that the Canadians come to America for their surgeries and their medical care, and that you guys are waiting in long lines forever. What is your response to that?
I don't know. It hasn't been my experience. I mean, the last major surgery I had was I had a chronic sinus infection that I had for about 10 years. I had it diagnosed in New York and in Canada, and it was going to cost me $35,000 to do it in New York, and it cost me $5,000 to do it in Montreal. So, I mean, I don't know who wouldn't. And it was a Harvard doctor that performed a surgery on me who lives in Montreal. Like, the level of quality of care was excellent.
Right.
I think the vast number of Americans would receive much better. It would just be better. I mean, it's a lot more complicated in the U.S., but I don't think that's any reason to not do it, because it's so obviously a better system.
One of the arguments that we're trying to make is the moral argument that healthcare is a human right. Do you believe that healthcare is a right?
Absolutely.
I want to say that healthcare is a human right, and if all this garbage that we're going through now somehow can result in poor people in America having access to healthcare, then maybe it'll be worth it. I don't even know.
When it comes to like healthcare as a human right, it's something that all of humanity is kind of in the same boat, and it's not just an American versus a Canadian issue. I do think there's a moral component to it, and I just think that there's been this kind of smoke screen tactic of kind of tricking the people that would benefit the most greatly from having access to healthcare into thinking that somehow it's going to negatively affect them. It's not a lottery, you know. It's like, I don't think that where you're born or how much income your parents have should determine how long you live, because all of us are going to get sick, and every single one of us is going to die at some point, and it's probably going to involve cancer, or it's probably going to involve a lot of things that afflict the rich and the poor, and that afflict all of humanity, and that the earlier we combat them, the earlier that we tackle it, the less expensive it is on the system as a whole. And yeah, the more people benefit, the more people get to live longer and hang out with their great-grandkids. There's too many people dying of really basic, treatable, illnesses in the U.S. Yeah. It's insane.
I just want to ask you about that moment at the All-Star game. It was a very heated 2016 election, and you decided to use that moment to talk about politics, and you were immediately cut off.
Yeah.
I would assume that you, going into it, you thought maybe ESPN wouldn't be, they would potentially cut you off. What was it like in that moment? Were you nervous to do that, and were you expecting
It wasn't really a
off?
plan. I just, I kind of had that little moment with the microphone, and I mean, the ironic thing is that basically politics is a reality celebrity TV show, so to be cut off for like talking about politics at a celebrity basketball game. I think the line she said was, "We're here to talk about celebrity stuff," and we had elected the celebrity apprentice to be the president. So it's just like, the whole thing is so absurd. Yeah. I didn't do it because it would make any sort of impact. It was just like, it's very rare that you have that moment where you're kind of on national TV and you have a second that you can say something that you believe in. And it's one of the things that's really great about Canadian society is that aspect of kind of taking care of the less fortunate and taking care of each other, and it's something the U.S. could learn from, And I'm saying that as an American. I live in New Orleans. Like, I'm from Texas, but I don't think that healthcare needs to be the Wild West, and it shouldn't be like a scratch and win, like, hope my parents have money, like, oh no, I was born without money, and so I have to die of something really, really silly.
Why do you think Americans should support Senator Sanders' Medicare for All bill? And how do we get people involved in the grassroots movement to pass this bill?
Well, the people on the other side are extremely powerful and are making a lot of money from the status quo.
Our opponents on this issue have the money and they have the power.
You kind of have to look at it and see who's actually making out from this whole scenario that we have in the U.S. And it's a lot of drug companies. It's a lot of really, really immoral companies that are making a ton of money off American illness. Just a single-payer system is really the only way when you're dealing with something like healthcare that is something that affects, I mean, to say that you have to go to the DMV to get your driver's license and have this whole system of the DMV, and yet healthcare is like a Wild West shootout free-for-all, it just makes no sense. I mean, I would so much rather have the DMV be a shit show and have healthcare be taken care of, you know? You know, like, why don't we just trade those?
Thanks so much for doing this. We really appreciate it, and have a great show.
Yeah, thank you very much. Yeah, appreciate it.